How are you? Welcome to another question and answer session. This is the physiology portion. Which of the following feature does not put a patient at a risk of refeeding syndrome? So there are different risk factors in which refeeding syndrome develop. We have to find out in which situation refeeding syndrome not develop. Here are the options. BMI less than 16 kg per meter square, alcohol abuse, thyrotoxicosis, chemotherapy, and diuretics. So first of all, let's see the refeeding syndrome. So this is the nutrition refeeding syndrome. Refeeding syndrome described as metabolic abnormalities which occurs in feeding a person following a period of starvation. And for this condition, some important metabolic abnormalities occur. So what is refeeding syndrome? It is in metabolic abnormalities when occur a period of starvation. But what are the metabolic abnormalities? Here, the hypophosphatemia, that means the phosphate level reduce, hypokalemia, potassium level reduce, hypomagnesemia, that means magnesium level increase, abnormal fluid balance, and these abnormalities may also lead to organ failure. So all the parameters usually reduce. So refeeding syndrome, if the patient not eaten more than 5 days. So when more than 5 days not fed, so he or she is in a risk of development of refeeding syndrome. For this condition, less than 50% energy and protein usually refeed to prevention of the refeeding syndrome. So usually a person needed 20 to 30 kilocalorie energy every day. So when we refeed in case of long starving person in this condition, we should start 10 to 15 kilocalorie per kg per day. So who are the high risk? Here the high risk: one or more of the followings: BMI less than 16 kg per meter square, unintentional weight loss more than 15% over 3 to 6 months, little nutritional intake more than 10 days, hypophosphatemia, hypomagnesemia prior to feeding. So these are the risk factor to development of the refeeding syndrome. And if two or more present of the following, that BMI less than 18.5 kg per meter square, unintentional weight loss more than 10% over 3 to 6 months, little nutritional intake more than 5 days, history of alcohol abuse. This point is very important. The alcohol abuse, it also acts as a starvation, drug therapy including insulin, chemotherapy, diuretics, and antacid. So these also enhances the consequence of the refeeding syndrome. So what is the feature which is not a risk of refeeding syndrome? Here the answer is ready, which is the thyrotoxicosis. Other options here such as the BMI less than 16, it may cause refeeding syndrome, alcohol abuse, chemotherapy, diuretics, they can cause refeeding syndrome.